All right, I know you were at that briefing earlier today, but just for now, can you confirm to us that we have just 3 confirmed cases from Bayelsa State? Can you confirm that that is still the case as you speak to us tonight?
That is definitely still the case. We have 3 confirmed cases from Bayelsa. We have quite a number of other samples awaiting testing, and we should have a few more results by the end of the week. But that's definitely the situation at the moment.
All right, in all this, have you been able to establish the initial source of the outbreak from the index case? I know there's so much information about who you've confirmed and the samples that you have, but in terms of how this all started, there's so many theories about someone eating meat, or where did it actually come from? Have you established that?
So investigations are still ongoing about the specific route of transmission for what we call the index case, the first case. However, it's the most likely scenario. Monkeypox is a virus that circulates normally in animals. And so from time to time, this virus jumps from animals to humans, and that's why we call it a zoonotic infection. And that's the most likely scenario. What specific animal it jumped from to the first human is what we're looking at the moment. But, you know, in terms of control measures, it's important to remember that the risk factor for humans is not in eating the meat, but it's actually in preparing, in touching and playing with animals, especially when you find a sick animal or a dead animal. So it's actually in hunting and touching and playing and killing animals where the greatest risk lies, and not in eating a well-cooked or well-fried meat anywhere in the country.
Well, I know one of the things that Lagos had been commended for during the Ebola scourge at the time was contact tracing and monitoring primary and secondary cases. What's being done in this particular case in terms of quarantine, etc.? Now that you've confirmed that 3 people actually have the virus, can you tell us anything about what your agency, for instance, is doing about tracing those who've had contact with those people?
Yeah, so we've done a fantastic job, but it's important to remember that this is not actually being led on by the Nigeria Center for Disease Control. Our role is to support the states. And just like you mentioned Lagos in the last, in your comments, we must actually really recommend the work done by the Bayelsa State government, the Commissioner of Health and his team. They have been at the forefront of the response to this outbreak. We've had a team supporting them for over 4 weeks now. They've been in Bayelsa throughout this period. We've been able to identify all the cases that fit the case definition. There have been several other rumors, so every day there are 3-4 new rumors. We go out, support the state in investigating, checking whether they meet the case definition. If they do, they're isolated at the Niger Delta University Teaching Hospital. So it's almost exactly the same approach as was used for the Ebola outbreak response, but it's important to remember that we're talking about 2 completely different viruses with 2 completely different scenarios in terms of fatality and risk to humans. So yes, we've done a very good job with the government of Bayelsa State. However, I think we don't want to really compare this with the Ebola scenario because they're 2 completely different scenarios.
All right. In light of the report, I mean, the unfortunate report, where we understand someone has actually taken his life, someone who is actually infected. What is one to do when one finds that you have such symptoms, or a family member has such symptoms? I mean, you don't want to just say, don't panic, but what would you be able to tell Nigerians tonight as they're watching that they should do in the unfortunate case that they do contract the virus somehow?
Yes, it's a real pity, and together with the Honorable Minister, we called the Honorable Commissioner for Health in Bayelsa to express our condolences to the people of Bayelsa State for this really unfortunate incident. Now, this virus, the monkeypox virus, really looks worse than it is. The pictures have been circulating online, and it looks like a really difficult disease to deal with. In reality, it is not. We haven't had a single fatality. Most cases have done well. Many have been discharged. A few people are still in hospital, primarily for public health reasons. So I'd really ask Nigerians to calm down. I know it's easy to say, But, you know, we do face other health challenges in terms of priorities. And monkeypox is actually fairly low on our list of priorities of infectious diseases because, you know, the associated morbidity and mortality, i.e. the number of people that potentially could die from it, is very low. So I ask Nigeria, this government is working very hard to improve our public health sector. We ask you to have confidence in our public health system, go to a primary health care facility. If we think it's monkeypox, every primary health care facility in Nigeria has been told what to do through the channels with which to report it up. And we commit to Nigerians that we will do everything we can to make sure every case is diagnosed. We're going over and above the call of duty to reach out to people to make sure we can get a diagnosis and to reassure Nigerians that we're on top of this and we're doing our very best to control the outbreak.